Good afternoon and welcome to our next installment of Diversity Dialogues celebrating Hispanic and Latinx Heritage Month. We will get started in just a second as more folks sign on. I'm so excited to reignite this virtual conversation series for our new 2021-22 academic year. And we have a fantastic guest today who is no stranger to VCU at all because she is an alumna of VCU School of Dentistry, or what probably was called MCV at that time, the Medical College of Virginia School of Dentistry. So I'm so excited to welcome Isabel Garcia, the Dean of the University of Florida College of Dentistry, who is with us here today to really talk about her career and her journey. I'm so excited to have you. Welcome.
Thank you so much, Dr. Smith, and I appreciate the invitation, and particularly that this comes as we celebrate Hispanic Heritage Month. So.
Yes, we're so honored and humbled to have you to join with us, particularly as an alumnus of the institution and of the School of Dentistry. And I'll go ahead and get started with our questions, and if we have time, we may take a few live questions either via chat or the Q&A feature. You can put a question there for us this evening. So one of the latest frameworks for ethics in dental education is the narrative ethic lens or model and the power of storytelling. With that, and particularly as the first female Hispanic Dean of the University of Florida College of Dentistry, which is just one of your many career accolades, I would love for you to begin by simply sharing your story with us. Where did you grow up? What influence do you think your family of origin had on you and your life's choices?
Okay, well, thank you. That's a great question to kick things off. So I am the youngest of 4 children, and I was raised in a very close-knit family in a small town in eastern Cuba. I was 15 when we came to the US, and like so many immigrants, my parents set a really exceptional example, I think, of hard work and integrity, and persevered really in the face of a lot of the challenges of immigrants, learning a new language, adapting to life in the US, and working, very hard to acclimatize to everything being new. So to be honest, I don't remember many discussions at home about pursuing a career. It was just kind of an unstated expectation that we would do well in school and pursue some kind of scholarly or professional career. My dad was a pharmacist. My mom was a stay-at-home mom until later on when she went to work for the first time, basically to support my sister and I through our studies, including dental school. And so as many other immigrants that experience starting over in a new country, creating a new life, that is a huge and stressful adjustment that I think forever influences your outlook on life. And it teaches you to be flexible, to be adaptable, and very likely has a lot to do with my ability to persevere, to work really hard, and to really never take for granted the many blessings that life in the US can offer. So I think I really kind of follow my heart in making career choices and make sure that I did my part to ensure that the many sacrifices that my parents made in coming to the US would not be in vain.
Awesome. Thank you so much. That's a wonderful story and about your journey. So with that in mind, what was your first exposure to dentistry and what really prompted you to pursue a dental career?
Yeah, so I'm the youngest of 4, and of the 4 children in the family, I am probably the very least likely to have pursued a career in dentistry. I grew up in in a town with no fluoride in the water. And we kept a very traditional diet, which was healthy, but included a lot of sweets. And so by the time I was a second grader, I remember locking myself in the bedroom to avoid the dreaded visits to our family dentist, who happened to be my uncle.
Oh, wow.
And so my exposure to dentistry was a scary one, really. So I had, lots of decay, despite, I think, knowing the basics about oral hygiene and oral health. The diet contributed to a lot of untreated decay. So little did I know I would find myself, some 15 years later, trying to calm fearful children in the pedo clinic when I was a second or third year dental student at MCV VCU. So I really sort of got lucky in some ways. Through a college classmate, I became intrigued with the art and science of dentistry. And even though I had those negative childhood experiences, dentistry was just really a great fit for me. Fortunately, I like people, I enjoy science. It turns out that I had good psychomotor skills. And so I really enjoyed particularly the clinical curriculum. So I guess you can say that I almost stumbled upon this after, realizing that this was an important part of being healthy, right? And I guess you can say that I was motivated to help people that were just as fearful of going to the dentist as I was, and still am, by the way.
That you still are?
Better. I am much better now that I understand what's going on and every part of the procedure and every step along the way.
Yeah, sometimes we know too much. Maybe that's why we don't always make the best patients.
Yeah.
So tell us a little bit more about what your experience was like here as a student at MCV and VCU, and how do you feel like being here influenced your career or your next steps once you left here?
I could joke and say that I barely remember because it was so long ago, right? I always talk about how I graduated in the dark ages. But I was a young dental student. I graduated when I was 24. And so in a way, I kind of matured a lot in dental school. I grew up, in dental school. And so I remember great classmates and generally a very supportive environment, but also an environment that was starkly male dominated. So this is the late 70s. I graduated in 1980, which sounds like so long ago.
No.
How you have to scroll down the page when you have to find your birthday, like 5 pages down, you get into the 1980s. That's me. But my English was not real great at the time.
Okay.
And so I didn't socialize a lot. I was a very serious student. I missed a lot of the Friday evening keg parties and, all that fun. But I would say that in general, it was a very good experience. I do recall not so fondly the dress code, which was written for men. It talked about the tie, the necktie, and all of these things that didn't apply to us. I also recall having no female faculty members at the time. There might have been 1 or 2 by the time I graduated. So at that time, the majority of female students in the building were the dental hygiene students. And in fact, I remember the guys in the class, right, being very excited because the dental hygiene students were coming to do certain rotations with us. And, since they were real women and the rest of us are just treated like the guys,
Oh my goodness.
It was a real development. But yes, it was just a very different time, right?
Sure.
And in some ways wasn't that long ago, but it was, you know, the dearth of women, I think, was notable. And even though I didn't pursue public health for many years after graduation, I recall doing some community rotations and also being heavily influenced by Dr. Eddie Ortiz, who was an adjunct faculty at the time, and I worked with him as an associate, and also by Dr. Dom DePaula, who was back then a relatively junior faculty at VCU. Later, he became the dean of 3 different dental schools. He taught human nutrition. At VCU, had a very global view of dentistry. And I think that sort of opened my eyes to other horizons beyond, you know, the more traditional path of clinical dentistry. But overall, I felt very, very well prepared clinically when I left dental school. I think I got a really great education. And no, Dr. Smith didn't pay me to say this. But it really paved the way for my return eventually to graduate school and residency later on.
Wow, that's really helpful and really aligns with a lot of the literature that I see in terms of both with women and what we categorize are underrepresented, you know, in the field, students, the impact of a faculty mentor or the presence of someone that kind of takes them under their wing. So it's really insightful that that is your journey as well. So tell us a little bit then about what was next. You said you didn't immediately go into public health dentistry. So what did you do after you graduated? And then what did eventually lead you to enter the U.S. Public Health Service?
Yeah, so I was Dr. Ortiz's associate down in Hopewell, Virginia for a number of years. And I was also working in a practice in Richmond, across Huguenot Bridge out that way in Richmond. Did that for a few years and found that I really enjoyed private practice. I loved seeing patients. But I became more interested in public health and being able to do more at the community level. So I met, you know, again, I'm gonna mention some names because these are people that were such wonderful mentors to me, were very influential in sort of how my career kind of took a different trajectory. Dr. Joe Doherty was at the time the dental director in the Commonwealth of Virginia. And through him and others, I began to appreciate sort of the special rewards of working in public health settings. So I went to work for the state of Virginia doing clinical work, but in a public health setting in Stafford County, Virginia. And it was through that work that I realized that I needed to have more formal training, that I was working in a public health setting, but I didn't have the skills of the formally trained a public healther. So I went back to school. I went to University of Michigan for my MPH and residency in dental public health. And that was sort of the trajectory that eventually took me to a career in the public health service. So, but it was really that public health training that gave me, I think, a pretty strong foundation of the basics of scientific inquiry, of epidemiology, of management and financing of dental care. And that training took me then to a couple of other states where I worked in public health settings. Eventually, I wanted to head back to the East Coast, where most of my family remained in Virginia. And I joined the U.S. Public Health Service as a commission officer. I was a lowly lieutenant commander, but it was really one of the best decisions ever. I learned more about the Public Health Service from colleagues that were in the dental public health circles. And so that career in the public health service allowed me to work really for the first time with teams where I was usually the only dentist. And that was a very different experience, right? Having to sort of justify why oral health is important to people that really didn't, were not exposed to it necessarily. And it really helped me to learn to define problems in a unique way and to solve them through kind of a public health lens and perspective. I think, that training and experience in public health is something that I think I still follow today when making decisions, right? Defining the problem well, articulating the choices, making sure that you spend resources in a way that benefits the most people most of the time. And so for those reasons, today, I really value my public health training, experience, and viewpoint. And I would say that it has come in particularly, has become very, very important as we really had to face the COVID-19 pandemic and sort of taking that public health approach to, how to keep the school open, how to make choices that are safe. All of those things I think have been really, really helpful in my whole career, but particularly during the last couple of years.
Yeah, I think that's so great. How it really tied so many different things together. Do you feel like when you were making the choice to really pursue public health, do you feel like there was a stigma at all attached to that versus kind of the traditional model of just simply private practice?
That's a really great question, and the answer is yes. I oftentimes remember being asked by colleagues, so when are you going to stop doing, public health and kind of do real dentistry, right? It was almost like, this was not this is not what you trained for, right? That I wasn't using my expertise because at that point I was no longer clinically active. I was doing many things in the community and research and, community outreach and surveys and all sorts of things. And so, it was an opportunity to educate, right? To have people understand that there were different reward systems, that I was contributing to the health of the community in a different way, and that I was indeed, using, every bit of my expertise that I learned in dental school and just applying it in a different way.
Awesome. It's so broad. And so I think that's so beautiful and so useful. And we're still trying to make, I don't want to say that argument, but in many ways, in talking about advocacy around how important oral health is to overall health and systemic health, there's still, sounding boards that we're butting up against for those conversations and the integration within, major health systems and all those sorts of things. So that's really powerful. So you also had quite a storied career with NIDCR, the National Institute of Dental and Craniofacial Research, retiring, I believe, as their deputy director. Can you tell us a bit about that journey and how you made the pivot from public health service to more hardcore research?
Sure. So I joined the public health service when I was already about 12 years out from dental school. And so I thought it was a great career move. I met a number of people that were in PHS, and it seemed like a really great choice because you could get, many, many different assignments, but eventually retire from the same system, right? And I wasn't too interested in being tied down to a particular location or a particular job. And so I knew it was a good career move, but I never imagined that I would have had the opportunities that I did to work with really some of the best and most talented people in public health. One of my mentors was Dushanka Kleinman, who at the time was the deputy in the Dental Institute. And she recruited me to the NIDCR, where I figure I would stay a few years and then move on and do other things and do other tours of duties. And as it turned out, I was in the PHS over 22 years,
Oh, wow.
19 of them at the NIH. So that journey really gave me the opportunity to just meet fantastic people in dental public health and research. And it really paved the way and opened doors for me. Some of those people have become lifelong mentors for me. During that time at NIDCR, I had the pleasure of running a dental public health residency, which over a period of 20 some years trained some really, really outstanding people, including one of your own faculty. We were talking about her earlier, Dr. Akikunwe Ronki.
Yeah.
That experience was just a huge eye opener. I accepted, every assignment that they could throw at me. It really pushed me beyond my comfort zone. I learned a lot of science. I learned tons of lessons in leadership. I did a lot of writing for policy pieces and other institute priorities. I got to run a couple of strategic plans, it was the whole gamut. And so I got a chance to work on some outcomes research and healthcare quality related themes. And I also, enjoy one of the real beauties of being in the public health service, in that I was deployed to an overseas humanitarian mission to provide care to people in need in 12 countries in Central and South America.
Oh, wow.
I went to 6 of the 12, not all. And it was through the deployment of the naval hospital ship, the Comfort. And so I just found huge satisfaction in the work and I had great mentors to help me with that. Dr. Kleiman, Dr. Larry Tabak, who is now the principal deputy director at NIH, was my director at the time. And so, never in my wildest dream I could have imagined occupying the deputy director's office of my own mentor, some 12 years later after joining NIDCR. But I was just really fortunate to be in the right place, to have great mentors. And to be quite honest, to take the plunge and accept assignments that at the time seemed not only impossible, but also scary and crazy.
Sure.
Right? That feeling that you're not ready for this, but having people that just encourage you and believe in you, and applaud when you have successes and are forgiving when you screw up, because everyone will, right? Which is really a wonderful opportunity.
That's so wonderful. I've been participating this year in the Leadership Institute with ADIA, and we actually have been meeting the last few days. And today we talked quite a bit about trust as a currency within organizational dynamics. And so that seems to be kind of oozing out of what you're talking about. You keep highlighting mentors along your whole journey. Would you like to say anything about that more specifically? How important maybe mentorship has been, and even mentoring others?
Absolutely. I mean, some of those individuals that I mentioned, I still consider mentors today, right? We need mentors for a lifetime, but we also have to pay it forward and see ourselves as mentors, either formally or informally. I think it's just a really critical part. But mentoring is a two-way street, right? You're not coming into the relationship, trying to seek something for yourself. It's really a two-way street, a partnership, where you need to have clear expectations of what the mentoring experience is about, and you also have to be willing to give, and not just seeking for yourself. And so I think having clear expectations is really important, and obviously just having personally the connection with these individuals was really key. But without mentors, I think life is lesser. And professionally, I think we would be wanting a lot if we didn't have those people to guide us.
Yeah, sure. That's really insightful. So you were at NIDCR, and then did you make the pivot directly to Dean of the University of Florida College of Dentistry? Had you done any formal, well, you obviously taught in dental public health residencies, but how did you decide to make that full switch on to dental education?
So I did. It was another, crazy move. And I guess you could say I flunked retirement because after the 22 years with the public health service, I retired, and I was fortunate to be selected as dean here at UF, College of Dentistry. I had taught, lectured, I probably more appropriate, at Michigan. And then when I was working for the state of Ohio, I had kept my hand in the academic life slightly, but it was a really pretty minor effort. But I think I always wanted to return to dental school and be part of the professional development of young aspiring dental students. And so I decided, I wanted to hang it up from PHS, but I still have a lot of energy and ideas and things I want to accomplish. And so I came here to Florida for the deanship. Related to that, I just want to make a few comments about careers in dental education. Because I think, dental education jobs and careers are just so underrated. As you well know, we all have a tough time recruiting into faculty positions, teaching positions. Yet I think it's incredibly rewarding to be part of a teaching culture, to be part of teaching future generations of dentists and hopefully leaders, helping to shape their careers, their viewpoint, and hopefully guide and inspire them to also be people that never lose sight that dentistry is a career of service to others. Those are my thoughts about pivoting to the dental academic world.
No, yeah, I think that's great. I went to Michigan for dental school, so I guess
go blue.
Yeah, go blue. With that, we have a couple of Ohio State faculty, so they won't like that comment, but it's okay.
Ohio State.
Yes, I married a girl from Ohio, so I usually have something in common with Buckeyes. Was Bob Bagramian, was that the public health person when you were around? Okay.
Marilyn Woolfolk and folks like that.
Yeah. Dr. Woolfolk and Dr. Bagramian I know real well. So that's a small world. And talking about dental education, and usually we have plenty of students that watch as well. What would you say are the prime opportunities of an academic career?
So I would say that people that are in dental education are really special kind, who have not only the talent for doing obviously clinical dentistry, but teaching it, right? And so I think being in dental education is just a huge opportunity to shape lives, to mold careers, like many of the people that I mentioned earlier were able to influence and mold my career and to play really meaningful roles. I think being in dental education gives you the opportunity to be in a really stimulating environment. You get to work alongside great colleagues. If you're in an academic health center like I am, and I think where you are, you also get to interact with many other people in the healthcare field. And I think that is, increasingly important and valuable to all of us in dentistry. So I remain very optimistic about the opportunities in academic dentistry. It just has a different set of rewards. But I couldn't be happier and more proud of the young people that I interact with. who I think are just full of promise. And we all joke about not being able to get into dental school these days because they're very strong academically, they're community oriented, and they're just overall just, really great people.
Yeah, I would totally echo and agree with those sentiments there. To shift the conversation just a little bit, according to ADEA, which is the American Dental Education Association, we are finally reaching parity in terms of female dental student numbers, and hopefully leading us to actual active practitioner parity in the future as well. As a woman in the profession, what would you say has been the most rewarding aspect of your choosing dentistry as a career? And at the same time, what has been perhaps the most challenging?
That's a great question. I think dentistry really opened up a world of possibilities that I never thought existed for me. As I mentioned, the opportunity to care and serve for others, the chance to teach and pursue your own scholarship, to meet and work with people around the world and the US are things that I really value and that have been very rewarding. And as a dean now, of course, I get to interact with, great people who want to do really good things in this world. In terms of challenges, I think dentistry tends to attract people like me. My phenotype is one of being a perfectionist.
No, never.
So to get into the rewards and challenges part of things, right? I would say that the need to always get things absolutely perfect can sometimes weigh heavily. Another challenge that I think is less personal, but on a broader scale, is that dentistry is still viewed as an elective service by many people, right? And even within the health professions, there isn't as much understanding and appreciation of the role of dentistry, of oral health and overall health. Though we have certainly made many strides in recent years. So I think, those are, some challenging things that remain, among with, many others that I'm sure we can talk about further.
Awesome. Yeah. And if those that are watching live, if you have questions, you can put those in either the chat or the Q&A feature, and we're going to get to those in just a minute. Well, one actually is in line with kind of where we were going already. It's a question that says, are the leadership opportunities for women improving, particularly in the last few years?
I think the answer is yes. And again, we talked a little bit about the mentoring role, right? For us, women that are in leadership roles, I think we need to take that mentoring of others very seriously. I think the landscape looks very different from what I described in 1980. Certainly we have a number of, incredibly successful leaders in academic dentistry who are women. More than half of our dental school applicants are now women. And so I think that the whole landscape will really change as a result. Within the dental schools in particular, I do think that we have some work ahead, because oftentimes if you look at the senior leadership within dental schools, right, we certainly are not there yet. And there's probably a cohort effect, right, that we really need to make sure that we're looking at our bench, to use the sports analogy, and make sure that we have a deep bench, that we are we're grooming and mentoring and enabling females to see themselves in leadership roles, and guiding them and inspiring them to get there.
Yeah, thank you for answering that question live for us. in the same sort of vein, our numbers of Hispanic and Latinx students and faculty are not representative of the US population that is ever growing of Hispanic and Latinx communities. I think in the most recent results from the 2020 census information, even nearing 20%, of our US population. As someone of Hispanic heritage, how has your ethnic background and race influenced your career trajectory or your passion for dental public health?
That's a good question, and it's hard for me to separate race, ethnicity from career and life choices, right? But I would say that my experience and as an immigrant certainly swayed me towards a career of service and to give back to people and communities that, despite the riches in the US, still lack access to dental care. So I think that's probably the most direct way in which I think, my life story, I guess, my life experience really influenced me to go into this direction, and specifically into public health. I meet a lot of young people today that are really passionate about serving others, and I think that's very encouraging. If this happens to include a broad cross section of people of diverse backgrounds, life experience, race, ethnicity, culture, religion, you name it, we will all be the better for it. I think it's, parenthetically, I will add that it's interesting that the COVID pandemic has increased the interest in public health and public health careers like never before. And so, here is perhaps a silver lining in all of this, uncertainty and misery that we've had to endure with the pandemic. And I'm very encouraged to see that interest, both among our dental students, but many others among undergraduates, for example.
I think that's so, if there is a silver lining to be had, I mean, there's a lot of literature about the power of disruption and all those kinds of things out there, particularly in business literature, but, that it kind of peeled this veil off of a lot of our health disparities that as health practitioners, we're typically intimately familiar with, but it became sort of almost dinner table conversations, the differences in population groups and how they were suffering, or vaccination rates and all those kinds of things. So for public health to take on, a center stage in terms of how you can help people population-wise has definitely been a silver lining there for sure. So with dentistry, do you see, and you sort of answered this in a way, with dentistry and dental education, do you see it as more inclusive than when you were a dental student? And how do you envision an even more inclusive profession of the future?
So I do think that dental schools really recognize and celebrate differences and values of an inclusive environment. And it's certainly way better than I was when I was a dental student. Clearly, we have a long ways to go, and each of us has a part in seeking out young, talented people from diverse communities, right, and attracting them to dental careers. So I think, diversity, equity, inclusion are all part of, our school's agenda, your school's agenda, and I think across the board. But I think we're all looking at many tools and options, right, to increase enrollment of underrepresented groups in dentistry, because certainly we are nowhere near where we need to be in terms of the proportion of Hispanic students in the U.S., of Black students in the U.S. The number of Black active dentists in the U.S. is discouragingly low, and so I live in a state with a large number of Hispanics, and so Latinos are, as a proportion, pretty well represented in our school, but that's not the case in many parts of the US. So obviously, we all have a tremendous role to play in really ensuring that we have a more diverse and inclusive dental schools for the future. And, looking at scholarships, looking at pathway programs, working with pre-health students and advisors. I mean, all of those are the things I know that you think about a lot. Hopefully we can, together really begin to make a big difference and meet the aspirations for many of those students that are interested in dental school.
Thank you so much for that. And that, in a way, provides some answer to this question that was just posted. What strategies should be prioritized to ensure that historically underrepresented students are not only recruited to the profession, but are retained and persist on to a thriving career? So you started to mention some of those things.
Yeah, I love that question because, it's easy to be obsessing over the numbers and recruiting students and, increasing the proportion and the diversity in each of our schools, which is something that we all should be seeking to do. But it's something else, truly helping them succeed, truly helping them to find a welcoming environment that will help them find a home so that they can see themselves in the school. Having the, whether it's an affinity group or, some other means to make sure that they establish those relationships that are so critical to get through a tough curriculum. At the beginning, you had asked me about my dental school experience. Well, my experience was really helped tremendously by my classmates and people that, stayed up at night with me studying, and we would help each other out. And you really need to find that family and that community, right? No matter which program you're in. And so I think we have to pay a lot of attention to understand what are the needs, how do we support them when they're here, and how do we, I think, become mentors for a lifetime for those individuals. About 3.5 years ago, I formed a Black student advisory group here that meets with me and our Associate Dean for Diversity and Inclusion. My eyes were really opened to the experience of those students in our school, right? And we had many frank discussions about what it's like to be in dental school and here and in this state and with our history. And I think it just takes a deep understanding of what the experience is like. I am Hispanic, I'm Cuban American, but I don't pretend to understand the issues and concerns of every Latino community.
Sure.
Right? And so I think in being able to retain students and help them succeed in their careers and their lives, we have to seek that understanding and be there to support them. I participate in some pre-dental fairs recently, and many of the guests were recent graduates, many of them from communities of color, and it was just so rewarding to see them engaged, right, in recruiting the next generation. And they're the ones that can really make a difference to make it a truly welcoming environment for them.
I think that's so, you hit on so many really important things. I think particularly that there's no monolithic experience really for any student traversing the rigors of a professional curriculum like dental school, but particularly when we start to look at our historically minoritized or underrepresented populations, particularly obviously as Hispanic Heritage Month. And so even the diaspora of what it means to be Hispanic, or what it means to be Latino or Latinx, or if you don't choose any of those descriptors to describe yourself, if you're maybe Brazilian or something like that. And so, you know, I was in a seminar the other day where one panelist was Puerto Rican, one panelist was Costa Rican. I mean, they just had this rich plethora of differences and angles in terms of coming at that. So I'd be remiss if I did not mention that ADEA, again, American Dental Education Association, pretty soon they've already announced that they're encouraging schools to participate in this dental education-wide climate study, where we'll be looking at things like, what does it mean to belong and feel like you're a part of a community? I happen to be on the task force, I guess, if you will, that's developing that instrument. So I'm really looking forward to dental schools across the US and Canada, and even dental hygiene programs that aren't attached specifically to a dental school, participating and giving us some real data points to say, okay, these are the experiences of our students, both minority and majority students. What can we do to enhance their well-being and those experiences? So yeah. So we have a couple more questions, and then we'll start closing the night down. We so appreciate your time, but I want to get to this. So in general, would you like, this might be a little controversial, do you have thoughts on Medicare inclusion? That is the big discussion right now about including a dental benefit in Medicare, particularly given your public health background and your NIDCR background. Do you have thoughts you'd like to share on that?
So, you know, I am just a pragmatic person. And I talked about my tendencies towards perfectionism, right?
Sure.
But I think when it comes to this huge opportunity to add such a needed benefit within the Medicare structure, we have to try to avoid seeking perfection and not letting that be the enemy of getting our foot in the door, the enemy of the good, right? So I know there's the controversy about whether you include everyone or you means test and only include individuals of certain economic level, socioeconomic level. I'd say this is a golden opportunity that hasn't come to this country in many, many years. I would favor just taking an incrementalist approach so that we get our foot in the door. I know there are pros and cons to either way, but I think it's just such an enormous opportunity that we need to figure out a way to really get it done, tweak it along the way, make changes, but not really miss the chance to really advance this critical need across communities that we will all be part of when we're elders.
Yeah. No, I think that's beautiful. Because I also wear an ethicist hat at times, or I guess all the time, with my ethics and professionalism duties and some work I do with the American Society of Dental Ethics. I really think about the ethical vantage point on this too. I think we have to be a part of the conversation when we're talking about societal trust, a social contract as health professionals, how our patients view us as hopefully not just money grubbers, or at letting our professional status really speak for it and not profit. So I think there definitely has to be a conversation, and hopefully we can stay in the conversation to where dental care for our elders is included is really a game changer for so much of a population that doesn't have regular dental care. So
yeah, and I think it's just an issue that is so critical that I choose to not be drawn into the divisiveness of this camp or the other camp, right? I think we just have to recognize that this is a golden moment and try to get something done.
Thank you so much for this, Dr. Garcia. We have one last question, if that's okay, from our viewing audience. and it says, what would your chosen route be to begin to close health disparities?
What would be my chosen
Your chosen route, or I guess,
route? Okay.
what's your pathway to close health disparities?
Yeah. You know, we have studied health disparities. We have published on just about every population group. And as a public health trained person, I would say that's wonderful because you have to define the problem well. But we have studied it enough. And I think, you know, action is really what is needed. I think there are so many communities that are already engaged in doing so much work to reduce health disparities that, you know, somehow we need to just really garner this energy and put it into, again, a cohesive and systematic strategy. You know, you can take the example of dental schools. Dental schools are a huge part of the safety net for many people that can't afford dental care, right? But the solutions for, I think, improved oral health, I don't think can come solely from dentistry. So, you know, partnering with our colleagues in medicine, with our pediatricians, we have programs here in our college that engage with pediatric residents for an early childhood prevention clinic. I think we have to really look at the problem from a broad perspective, understand that health disparities, oral health disparities occurs in individuals that have common risk factors, right? And so I think if we take that common risk factor approach and think of oral health disparities as sort of a subset within a whole bunch of other inequities and begin to go at it in a systematic way. I know it sounds, you know, a lot easier to say than do, but I think, you know, we have to look both within and outside of dentistry to be able to tackle this problem because it involves the social determinants of health, which are, as you know, are the, you know, many of the root causes and problems. And, you know, we are not alone in that. You know, our colleagues that are trying to prevent diabetes and hypertension and many other, you know, chronic non-communicable diseases are all in the same boat. And so I think, you know, really kind of coming together as a public health community with dentistry involved would really be a wonderful step forward.
Yeah, I was in a session earlier this week with Leo Rouse, and he said something that kind of caught me off guard, but it made total sense and is spot on with what you're saying. He said, while we may own dentistry, we don't own oral health.
Right.
And he talked about some initiative with nurse practitioners that he was working on. And I know even we have a faculty here in our Department of Dental Public Health that has some research and some publications with midwives and them introducing and being on the front lines of infant maternal oral health. So it's just a beautiful collaborative effort and spirit of collaboration that you're speaking to. And I think that's, you know, a wonderful place to end our conversation here. Is there anything else you'd like to share with our audience at all?
I just want to really thank you for the work that you're doing, for the opportunity to speak with you all today. I really, I'm in so much debt of the wonderful education that I received at VCU. And I think that we share the same belief that a bright future really needs to recognize and embrace the diversity that we all bring. I bring the Cuban American perspective, but I certainly value the mosaic that you know, the Hispanics and Latinos form in our communities. So thank you for the opportunity. I enjoy the chat.
Thank you so much for joining us. Thank you for this, for all of us who joined us live and those of you who will watch later on our YouTube channel. This is Diversity Dialogue celebrating Hispanic and Latinx Heritage Month, and we'll see you next month to celebrate Native American and Indigenous communities in November. Thank you.
Thank you.